A few updates on the activity of the White House Coronavirus Task Force. Then I'm going to ask Dr. Birx to speak about what we're seeing in the numbers. We know we are at the beginning of what's going to be a very tough week in America. But as Dr. Birx will reflect, because the American people have been embracing social distancing, putting into practice the advice of state and local leaders and the President's coronavirus guidelines for our country. As Dr. Birx will describe, we are not only seeing remarkable progress in Washington State and in California, where the numbers remain low and steady. That's a great tribute to the people of both of those states and to all of their dedicated healthcare workers. But we're also beginning to see a leveling just at the very beginning. And she'll reflect on those in just a few moments. A couple of quick updates. At the present moment, the President has approved 50 major disaster declarations, and we'll likely be issuing a disaster declaration for the state of Minnesota before the end of the day. We've distributed more than $4.1 billion to states. And right after our incredible healthcare workers, we couldn't be more proud of more than 21,000 National Guard that have been activated and are working in states all across the country. During my conference call today, I learned that Governor Brian Kemp is actually using the Georgia National Guard to sanitize and clean up nursing homes. But National Guard are being deployed in a variety of ways all across the country, and to them and to the families of all these citizen soldiers, you have our admiration and our respect. As the President mentioned, our focus remains on the New York metro area, New Jersey, Louisiana, and then Michigan and Illinois. We're watching every area of the country, but those are the priorities today. And in that spirit, I spoke today, as the President did, with Governor Cuomo of New York. The President made the decision to open up the USNS Comfort to COVID patients. And he also informed the governor of New Jersey that we would be taking New Jersey COVID patients. So now there will be two facilities, one at the Javits Center that's all COVID, and in the USNS Comfort that will be managing COVID patients. At the present moment, by this evening, there will be 2,179 medical, military personnel in New York City. And over the next 2 days, that number will rise to 3,000. Speaking with the governor, speaking with Mayor de Blasio, the President and I were informed that while we have surged ventilators, we have surged personal protective equipment, that sending in some relief for healthcare workers was vitally important. And so again, I want to emphasize that those are medical personnel, doctors and nurses and medical assistants who are on the scene now and will continue to arrive to a total number of 3,000. I spoke to Governor Phil Murphy of New Jersey. New Jersey is very much in the forefront of the coronavirus in America today. We want to commend the governor for his extraordinary leadership in the state. During our briefing today, we learned about the progress that they were making and also about the governor's decision to temporarily reactivate retired healthcare personnel in the state. And just as a reminder of all that we're dealing with this weekend, Governor Murphy told me that New Jersey surpassed the number of lives that were lost on September 11th to the state of New Jersey. And it breaks our heart to think of that. And our hearts go out to all of the families of the more than 10,000 Americans who have succumbed to the coronavirus. We also, as the President said, we express our gratitude to governors in Oregon and Washington State yesterday for donating ventilators to help the states at the epicenter of the coronavirus. Governor Gavin Newsom of California donated 500 ventilators. And I just learned that those will be going 200 to the state of Maryland 50 to the District of Columbia, 100 to the state of Delaware, 100 to Nevada, and we'll also be deploying the remaining 50 to the Northern Marianas Islands and to Guam. And we want to thank Governor Gavin Newsom. The state of California has provided extraordinary and compassionate leadership for their citizens. They're making progress. As the governor said the other day, they're not out of the woods yet, but the numbers speak for themselves, and the generosity of the people of California and the governor is gratefully received. Beyond that, before I recognize Dr. Birx, let me just say that at the beginning of this challenging time, we want to challenge every American to continue to do what every American can do. And clearly, what we see in Washington and California, and what we are just beginning to see elsewhere, is put into practice the social distancing recommendations of the coronavirus guidelines for America. Listen to your state and local authorities. We really do believe that while this will be a week of heartache, it also is a week of hope. And as we see some of the cases beginning to level just for a day or two, it is our hope that what we have seen begin in the greater New York area and even in Louisiana and elsewhere will become a trend. But it only becomes a trend if every one of us continues to take ownership and continues to do our part for this 30 days to slow the spread. With that, I'll recognize Dr. Birx for the latest data, and then we'll take questions.